According to the Indianapolis initiative Jump In for Healthy Kids, it is their mission to lower childhood obesity by 12% by the year 2025 by providing kids with various tools and ways to lead healthy lifestyles in their community. It is important that we too are taking those steps to lead healthy lifestyles and be good reflections within our communities. I feel that I'm incredible to speak to you all today on this topic due to the extensive research I've done and due to the new knowledge that I gained through the service project. It is important for us to take steps not only in the home but also in our schools to properly educate our kids and provide them with the knowledge necessary to know the importance of what it looks like to lead a healthy lifestyle. So today I'm going to give you a brief description of the organization I volunteered with, the task I got to carry out, and what I took away from the experience. So first, what I volunteered with. I volunteered with College Station ISD Child Nutrition Services. According to their website under general information, they are currently serving 2,100 breakfast meals a day and 7,000 lunch meals a day. So they have lots of kids that are regularly circulating through their lunchrooms. They are in charge of creating the meal plans for elementary, middle, and high school. This gets really complicated due to the set of guidelines that they must follow, and due to how the serving sizes change at each level for the kids. They are also in charge of making bids with companies to ensure that they are getting good quality food but also at a good price, and also making sure that the food that they are providing the kids meet all of the recommendation and all the nutritional values that are required at each level. So now I'm going to inform you on the task I got to participate in. I got the privilege of visiting 3 schools, an elementary, a middle, and a high school. I'm sure some of you can remember going to the end of the line and punching in your number. And I don't know about you, but have you ever wondered what the lady at the end of the lunch line does other than let you know whether you need to bring lunch, money, or if you have enough money for that snack you want? Actually, what she is doing is checking your plate. When kids come through the line, they must have a protein, a dairy, a grain, and or a fruit or vegetable, but they must choose at least one of the fruits or vegetables. When I was observing at the schools, I noticed that at the elementary level, kids did not want the vegetable. At the middle school level, I noticed that kids were more likely to bring their lunch but would go through the lunch line to get the extra snacks like ice cream and chips. Now, at the high school level, they do have 7 different lines to choose from, so their options are vast in high school. They are a closed campus, and so they're either bringing their lunch or eating on campus, which is nice to know that the food the campus is providing is nutritional and has met all of these guidelines. Until volunteering and working at the schools, I viewed the school lunches as cheap and bland. But if you're anything like me, you've not eaten a school lunch since your freshman year of high school, and since then lunches have changed a lot. Just in November, the Centers of Disease and Control and Prevention under the NCHS data brief, Prevalence of Obesity Among Adults and Youth, United States 2011 to 2014, it was released that childhood obesity was at 17%. The guidelines have been set in place to help decline this number. By the time students are in high school, they have hopefully had some education on what it looks like to choose healthy options, so that when they have those 7 lines to go through, they know what healthy options to choose. No, the food that they are getting does not taste like actual Chick-fil-A, and no, it does not taste like our mom's home cooked meals, but they are actually very nutritional and they meet all the recommendations that that child, he or she, needs. Seeing that schools are doing so much to take steps in a healthy direction, this has greatly inspired me to make sure that I instill healthy habits within my future children or any child I come in contact with. One way I've taken a step is that when I volunteer with Young Life at Bryan High, I no longer take my kids' lunch, because I know that the lunch I would be providing them with would be way less healthier than the lunch that they could receive at school. So in conclusion, it is important for us to take steps not only in the home, but also in the schools to stress the importance of childhood health. Today I hope I've given you a brief description of the organization I volunteered with, the task I got to carry out, and what I learned from the experience. Now that you know that schools are taking steps in providing education for children and making sure they are leading a healthy lifestyle, it is my hope that you too will begin leading a healthy lifestyle so that you too can be a healthy reflection for these kids.